So there is herpes simplex virus 1 and 2. So 1 will usually infect above the waist. 2 will usually infect below the waist. So if someone has genital herpes, pretty safe bet they have HSV2, but there is overlap. So will that affect your treatment? Not necessarily, but just keep in mind while this is the case most of the time, well, someone who has blisters on their gums or lip or something usually will have HSV1. There can be crossover. So that's something to keep in mind. Okay, so in a genital type of herpes, you have painful vesicles, and these painful vesicles have an erythematous base. So there will be pruritus in the genital area. There'll also usually be dysuria, and usually also inguinal lymphadenopathy. If there are systemic symptoms, then you'll usually have fever, headache, and myalgias, or so-called muscle aches. If the individual has antibodies due to a prior infection, then the symptoms are almost always less severe. And HSV can linger in the neurons. It can reactivate from time to time. Depending on the type of sexual intercourse, it can also, if you have anal sex, you can also have a proctitis, which will present with tenesmus, and also anal rectal pain. For diagnosis, you can do a viral culture